Hello everyone. As you know, premature ejaculation is a very common sexual problem that occurs between almost 10% and 40% in men. What can be done most practically in premature ejaculation? What is the most practical solution? We can recommend premature ejaculation sprays with a success rate between 80% and 90%, friends. We can say that it is really both very practical to use and has a very high success rate. Premature ejaculation sprays are in fact the sprays that dentists use before giving a numbing injection. There are 10% lidocaine solutions in these, friends. I can even say that these sprays are within the scope of state payment, covered by SSI payment. The important thing is how this spray is used. What should you pay attention to when using the spray? I especially recommend you to apply the spray half an hour before intercourse, if possible. Because the substance in the spray does not work within 5 to 10 minutes. In other words, if you apply the spray 20 or 30 minutes before intercourse, it is much easier for the substance to work and numb the penis. Secondly, how much you spray is also very important. When you spray too much, there may be loss of sensation in the penis and therefore erectile dysfunction. Simply put, you take the spray and spray it twice in the air so that the substance fills the nozzle completely. Then do a spray on the underside of the penis, so this is the back, this is the underside. Then a spray on the right, a spray on the left. Do it half an hour in advance. You can have intercourse after wiping the penis with a wet cloth before intercourse, friends. Now you might think that there are also gels and creams, why not them? Friends, using gel is not at all practical compared to using spray. Why is that? First, you have to squeeze the cream on your hand. It gets contaminated. You have to wipe and wash your hands. Because you can get your hand in your eye or in your partner's eye. Secondly, after applying cream to the penis, you have to make sure that it doesn't get everywhere, and that the bed sheets don't get greasy. Thirdly, you need to cleanse the penis well before intercourse, but unfortunately, since it is oil-based, it is not easily cleansed compared to water-based ones. So the use of creams or gels is not at all practical compared to the use of sprays. When we look at the scientific studies, the satisfaction rates of the sprays used are much higher than the oral medications. So not only is it practical and easy to use on a daily basis, but the results are very good. But if you use a spray and don't get good results, you can get sexual therapy. You can get training to improve position, breathing control, control of the pelvic floor muscles. Or you can resort to various treatments such as filler injection in the head of the penis, which can control your premature ejaculation for 3 to 5 years and increase your pleasure in sexual intercourse. You can reach me on WhatsApp, my number is in the description box. Thank you for listening. Best regards.